we can follow up with the additional resources afterwards. That would be greatly appreciated. Hi, Amy. It's good to see you.
Hello, hello.
Good afternoon, Sandy.
Good afternoon.
For those who just joined, if you could do us a favor and put your information in the chat window to make sure that we capture our audience, and then we will also follow up with some additional resources and a link to the recording after this session. And we'll go ahead and get started in about 3 more minutes. Welcome to those who just joined. If you could do us a favor and put your information in the chat window, such as your name, organization, and email, that would be great for our attendance records, and then also to follow up with a recording to the session and some additional resources. We're going to go ahead and get started in about 1 more minute, just so we can make sure that we're on time and we don't rush anybody per the usual. If you just joined, if you could please put your information into the chat window, that would be amazing. This includes your name, organization, and email. We will be following up with some additional resources, and this also helps us with our attendance records when we report back to our funders on what the outcomes of our presentations were. We're going to give people just a little bit more time to get logged in here, since we've got more people joining. So welcome, everybody. We greatly appreciate you being here. As I stated before, as part of our echoes, we do need to provide attendance records. So if you could please put your name, email, and organization within our chat, that would be greatly appreciated. And if this is your first time joining Echo, you'll see a link in the chat that will take you to a participant guide that kind of explains what echoes are. Since this is the 3rd in our series, we're going to kind of go over our typical Echo introduction and just jump right into the team introductions. I'm Krista Opsdahl. I'm the Echo Project Director at Minot State University, and I'd like to introduce the rest of our team. We have Joyelle Meyer.
Hi, everyone.
Do you want to tell us where you're from?
Sorry. I'm from the newborn screening program, so welcome.
Thank you. Amy?
Amy Burke, North Dakota Newborn Screening Program.
Wonderful. Jody?
Jody Patchen, MSU Project Echo.
and Kyle.
Erickson, MSU.
And we also have Nancy Hostetter from UND helping us with CMEs. So we would like to introduce our speaker for today, Danielle Hoff. I apologize, my screen got a little bit messed up here. Classic. Okay, so Danielle Hoff was born and raised in North Dakota. She currently resides in Bismarck, North Dakota, and attended Dickinson State University, where she graduated with a Bachelor of Science in Nursing and later attained a Master of Science in Nursing with a concentration in healthcare informatics from the University of Mary. In addition, Danielle is currently earning her doctorate in nursing practice with a focus in nursing organizational leadership from the University of Mary. She is expected to graduate in April of 2023, which is just right around the corner. Danielle has experience working as a nurse in a variety of settings, including a women's clinic, the operating room, and in public health. She began her career in public health serving as the state stroke and cardiac coordinator at North Dakota Department of Health. She continued to expand her knowledge in the public role as she transitioned to her current role as a program administrator and assistant unit director for special health services within North Dakota's HHS department. Please help me in welcoming Danielle.
All right, thank you, Krista. So if you just want to share my slide.
Can you see that all right?
Okay, perfect, I sure can. All right, so hi everyone. Like Krista said, my name is Danielle Hoff. I'm a program administrator for our Special Health Services Unit, which is a unit out of the North Dakota Department of Health and Human Services. And today I'll be presenting really just a broad overview of the essential elements, specifically for children with special health care needs, that promote continuity of care and how we can incorporate components of the medical home model into current policies and processes. So next slide. And I'd like to start off just with a little bit of data, just because I think it gives a nice snapshot of how we're doing as a state here in North Dakota in regard to medical home. So according to the 2020-2021 National Survey of Children's Health, 19.4% of children in North Dakota have a special health care need. Of those children, 37.5% report that they do not have a medical home. And therefore, we can see, I think we have a lot of opportunities for improvement in the medical home realm. As previous presenters have discussed, patient-centered medical home is really a model of care that is team-based and focused on meeting patients and families where they currently are. So it's more of, I guess, a guide or a framework to achieve quality care based on the patient's needs. Medical home, of course, is important for children with special health care needs because we know these children require more comprehensive care for their physical, developmental, behavioral, and/or emotional differences. The care coordination and transition process for children with special health care needs should really begin at birth or even before birth in some of those cases, and should continue through adulthood. So there's really no, I guess, endpoint in medical home. It truly does expand across a lifespan. So a good example of this is a referral to the early intervention program for eligible children should be done as soon as the diagnosis is confirmed. So for those of you unfamiliar with the early intervention program, it's a free birth to age 3 program that closely monitors the child's growth, development. They make sure baby is meeting all the milestones. And so one important factor is that children who qualify for the early intervention program here in North Dakota also automatically qualify for North Dakota Medicaid, which is huge for some families. And so this program is essential for families with young children with special health care needs that do require more healthcare services, and it really does promote that medical home model and coordination of services. Next slide, please. So the essential elements for continuous care. Continuous care improves health outcomes of children with special health care needs by fostering a high quality and comprehensive system of care that promotes the healthy development and well-being of children and their families. Most of us have probably heard of HRSA, or the Health Resources and Services Administration. They created and identified 6 core essential elements that truly describe the system of services that are needed for children with special health care needs to help them achieve optimal health outcomes. These elements you can see here on your screen. The first one is early and continuous screening. I think we've heard throughout the presentations the importance of early screening. So making sure that these children have access and are getting screened is important. So these can include things like newborn screening, well child visits, and referrals such as to the early intervention program that I mentioned earlier. The second element is coordinated care through a medical home, which I know we've heard a lot on these last presentations. And we've learned that ensuring a comprehensive care is being provided is really important for these children. So this could include something like offering multidisciplinary clinics in your facility. And I'll talk a little bit more about multidisciplinary clinics here in the next slide. The third element is community-based services that are easily accessible to families. So it's not only important to have these services available, making sure that families are aware of these services, but also making sure that they can access this. So making sure, if transportation is an issue, maybe doing different options for them, making it accessible to everybody to access these. The fourth element is effective transition from pediatric to adult healthcare processes. So having a transition process in place when a child begins to seek adult care, when they start to enter those teenage years, it's really important to have this process in place for quality healthcare. And again, I'll talk a little bit more about transition here in a couple slides. The fifth element of care is adequate health insurance. So making sure families have the ability to pay for the services that their child needs, or making sure you're connecting them or referring them to programs that can maybe help initiate those conversations and make sure that they have referrals to proper programs. So this might include a referral to the human service zones, so they can kind of talk about financial coverage programs, maybe Medicaid, or even just referring them to a local family support organization, such as Family Voices of North Dakota, who also helps make those essential referrals. And then the sixth element is developing a family professional partnership to aid in decision-making and share a plan of care. Next slide. So as I mentioned, I wanted to hone in just a little bit on multidisciplinary clinics. As we know, these clinics incorporate the medical home model by providing access to different medical providers in one place at one time. This benefits the family by not only saving them time and having to schedule a variety of appointments, but it also enhances the care coordination, communication, and planning among the entire medical team. So this greatly impacts not only the child and the family, but the medical team as well. Next slide. And so this is a list here on your screen of some of the multidisciplinary clinics that are currently being offered in North Dakota. This isn't a comprehensive list, but this is a lot of the clinics that either our Special Health Services office helps fund, or they're clinics that we refer a lot of our kiddos to. And so as I mentioned, many of these clinics are funded through by Special Health Services through our Title V Maternal and Child Health Federal Block Grant. And so every 2 years, our Special Health Services office puts together requests for proposals for healthcare and other organizations to apply for to improve the system of care for children with special health care needs. I'll just put in a little plug here that we will have a new round of funding coming up in July of 2023, so just a few months from now. So reach out to our office if you or your organization is interested in either funding a new multidisciplinary clinic, or if you have other innovative strategies to improve the health of children with special health care needs. Next slide. One of the healthcare organizations that receives funding from our office to offer multidisciplinary clinics is the Sanford Coordinated Treatment Center in Fargo. They offer a wide variety of multidisciplinary clinics, but Special Health Services provides funding to 4 of those, which you can see on your screen there. And so those include the neurodevelopmental, pediatric developmental, myelodysplasia, and the metabolic clinic. These are free clinics for families to attend, and the CTC utilizes some of the funding from this grant to offer travel reimbursement to families traveling longer distances to attend the clinics. And so I think that's a really great perk and benefit for families who'd otherwise not be able to, travel all the way to Fargo to attend the clinic, especially our families that live on the western side of the state. This slide also shows how many North Dakota children have been seen at these clinics in the span of a year and how often they're held. So we can see they're certainly being utilized and benefit our children with special health care needs in North Dakota. Next slide. And these are just examples of some of the providers that attend or are involved in the various multidisciplinary clinics at the CTC clinic. So depending on the type of clinic that's being held, these would just be some of the providers the family would potentially see at the clinic. Next slide. And then here, these are just quotes from some of the families. So when families attend CTC clinics, they have every family complete a survey at the end of their visit, really for quality improvement and assurance processes. But I think these quotes really just go to show how impactful and valuable these clinics are to the families that attend. And it shows how much they appreciate the multidisciplinary style of clinics and the care they receive from the various providers. In addition to these quotes, one statistic from the developmental evaluation clinic showed that 81% of the families would recommend the clinic to others. So again, I think this shows how valuable these clinics are to the families and to the providers, as it offers the opportunity for the multidisciplinary team to really collaborate together one-on-one and develop a plan of care with each other and the family as one team. Next slide. So transition from pediatric to adult healthcare. When children start to get into their teenage years, it's important to start discussing healthcare transition with them. The goals of transition are to, 1, improve the ability of youth and young adults, both with and without special healthcare needs, to manage their own healthcare effectively. And 2, to ensure an organized process in pediatric and adult healthcare practices is in place to facilitate transition preparation, transfer of care, and integration into adult-centered healthcare. Transition was actually established as a priority within our maternal and child health Title V program here in North Dakota. And we can see from the 2020-2021 National Survey of Children's Health, only 27.7% of children with a special health care need in North Dakota reported to receive necessary services for a proper transition to adult care. So again, I think as a state, we have opportunity to improve in this area. And it's really just an important step for our young adults as they transition into adulthood and become independent in their care. Research also shows an effective transition process can impact the young adult's health in various ways. So first, it can impact their overall health. An effective transition process has shown to improve adolescents' adherence to care, self-care skills, quality of life, and self-reported health. Second, it can impact their experience of care as an effective transition process can increase satisfaction and reduce barriers to care for the youth. And then lastly, effective transition processes can impact the utilization of healthcare. It's been shown to decrease the time between their last pediatric visit and their first adult visit. It can increase their ambulatory visits while decreasing hospital admissions and lengths of stay. Next slide. And then lastly, GOT Transition, there's 6 core elements. So GOT Transition is a well-known national resource center on healthcare transition. They have numerous resources for providers, for families, and the adolescent to aid in implementing transition processes. They also have a coding and payment tip sheet, so providers know how they can appropriately bill and code for those services. So any providers on the call, make sure to check those out if you haven't seen those yet. So Got Transition, in collaboration with the American Academy of Pediatrics and other national organizations, established 6 core elements that define the basic components of a structured transition process. The elements can be tailored to the type of practice facilitating the healthcare transition and assist providers in developing transition processes. And so these elements include, first, creating a transition process in a facility; 2, tracking and monitoring your transition aged kids; 3, conducting transition readiness assessments with them. And what's really nice is the Got Transition website already has these assessments created. And so you can take these right off their website. They have assessments for the youth or young adult and also for the parent or guardian. And so if you walk through that assessment with them, it really identifies the areas of education where they could really use some more education as they are transitioning to adult care. The 4th element is developing that plan of care. The 5th is transferring the care. And then 6th is completing that transfer and closing that loop of communication. So each of these elements do have resources associated with them on the Got Transition website. So I encourage you all to take a peek at their website. It is gottransition.org. So pretty easy. And they have really great resources on transition. Next slide. And that is all I have. I can either take questions now if anyone has any, or I will stick around to the end.
Thank you so much, Danielle. So I think we're going to wait until the very end for questions. And I put a message in the chat box. So if anybody does have questions, feel free to type them in the chat, or we can take them if you want to unmute yourself to after Dr. Casas is done. So Krista, if you want to pull up Dr. Casas's presentation, I will do an introduction for her.